Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 4, Clinical Governance, Leadership and Risk Management in Healthcare, we will be studying in today's chapter 45, Risk Management in Hospital and Healthcare Part 1. Here we will be studying the various steps of risk faced by the hospital. So what do you mean by risk and what is the associated management related to risk will be more a focus of discussion of today's topic. According to the Joint Commission, defines risk management in healthcare as clinical and administrative activities which are undertaken to identify, evaluate and reduce the risk of injury to the patient, even to the staff, visitors and the risk of loss to the organization itself. So here you can see it's a very comprehensive definition which is taking the clinical and administrative activities. They have to identify it, they have to evaluate it and even reduce the risk of injury to the patient. It is more a focus of giving injury as a very important aspect over here. The injury can be not only limited to the patient but even to staff, there are visitors, other stakeholders and the risk of loss to the organization itself. So here it is more talking about the managerial aspect of the risk. So managing risk is a proactive function and which is very important that you have to see that you have to go ahead with planning and the entire process of managing requires to take ahead with. It is taking action to reduce the frequency and severity of expected incidents. Because healthcare organizations are inevitable or you may come across any incidences which are very unpredictable actually to occur in the organization. So where risk management helps reduce the impact of legal claims and promotes high reliability performance design. Very importantly to say that healthcare institutions are growing very complex nowadays and you come across a lot of expectations of the patient and sometimes there are chances that the patient may go up into the risk. The uniqueness of each patient exposes the organization to potential liability that they come across with an activities or they come across with an issues which are very difficult actually sometimes to be taken for risk management. So when you have to see the different incidences which are there in the hospitals and you have to come across actually to evaluate it or to understand it, you have to go for the entire management of that. So here in this figure, we will try to understand what a clinical near miss scenario is being seen as and the medication order error which is being displayed in this flowchart. You will understand in this entire flowchart like how these incidents happen in hospitals frequently. And many of these hospitals which come across this issue, they try to understand this issue through an RCA, that is root cause analysis, or they need to work on those plans to first see that how to deal with this issue. They range from no harm to sentinel events. Sometimes actually the incident may not lead up actually to an harm to a patient or may not cause to a level of morbidity, or sometimes the incident can lead to sentinel events like a death of a patient. And it is reasonable to expect that a hospital with motivation to continuous quality improvement would do a root cause analysis. They can take corrective and preventive actions also. Preventive actions are one which are very emphasized actually on taking the activities prior rather than corrective actions which are majorly taken after the incidents happen. So in the very first incidents we can state that start patient admission and doctor's order. Here Mrs. Sumitra, who has gone in a C-section, admitted to an hospital and the doctor prescribes non-sucrose injection, which is an iron supplement. Where in the next incidents we come across a nurse action intranet search iron sucrose and nurse searches intranet for iron sucrose and search fails item not found. What the nurse over here come across that the element is not being seen and he or she fails actually to see that the element item is not being reflected. And in the next where you come across the communication with the pharmacist, nurse calls the pharmacist instruct to order and as an overcrow. So what is the issue over here? the critical error, misinterpretation or typo. What has lead to it is like incorrect order placed anti-neoplastics, that is IronCam. Nurse mistakenly orders ironocam anti-neoplastic drug instead of intended iron preparation. What was expected for the patient who has gone with the C-section over here? It is that the patient was expecting an iron supplement. And the patient, if it is getting the iron supplement, which will go with a proper treatment. But here the problem is done by the nurse, that she has searched for some very different thing and has interpreted something very different to the pharmacist over here. The pharmacist has taken an action on the basis of this, that the nurse has understood in a wrong way. So what is the intervention? The intervention which is coming with the administration, before the administration, might be through the pharmacist, might be with the team, or might be actually even through the nurse in the later step. So there is a near miss event. Sometimes there may be like a catastrophic problem actually. Sometimes it may not even harm. So the mistake identified by the system, by the staff over here before the drug administration. Before the drug was given to the patient, which might lead to a major problem, might be lead to a sentinel event, it was arrested. The incident took no harm to the patient. Okay, what is the outcome? The process review needs to be done. Safety protocols need to be initiated, where it is an utmost priority that before you go for such initiation, you need to thoroughly go with an action plan to understand what is there need to be improved. In this entire discussion, actually what we are trying to make for this particular case study is like, here there should be a check of understanding the things actually if it is not clear to a nurse with the doctor or to the prescriber. Then again, when the nurse is giving an order actually to the pharmacist for this, also need to have a second check before it is interpreted actually. After this two and confirmation is done, then only it should be go for administration, where the recording, the timing, the specification, again mentioning the name and each and everything before the drug administration should be done in terms of identification, which is giving you a complete, or I can say a best outcome results. If this sort of event happens in your organization, or if it is going in this scenario which is being depicted over here, you need to have a process review and safety protocol should be initiated, which is done after the root cause analysis, because these are the corrective and preventive actions which are suggested over here. So we saw this clinical near miss scenario, which may be seen as one which is protected or which is one which is arrested. If at all this miss event would not have led to a proper check or an intervention, actually we may come across that there is a possibility of a major sentinel event happening over here. Now, what is the attitude towards an error in the healthcare? Broadly, if you come up to a consensus among the healthcare experts that waiting for an event to happen before developing preventive measure is not enough. You may see that preventive is also being facilitated with lot of approach of the attitude of the healthcare employee. Since the 1960s, many risk analysis techniques have been developed, and we may see that in the whole existence actually of the different techniques that has been taken with the efforts of healthcare workers who have made this field more enriched actually with their value inputs. These techniques were adopted from other industries also. The other industries like nuclear sections, aviation industry, which has contributed a lot for different techniques actually, which has really contributed to the quality development journey. Healthcare has benefited from other industries, and healthcare has adopted this and has made mandatory that Joint Commission accreditation body insists the risk analysis. Risk analysis has become a part of healthcare organization. Most of the hospitals who are on the culture or developing a culture for quality, they go more priority to the risk analysis. And risk analysis is done for all organizations accredited by them. There where we find the prime importance of taking JCI is more towards developing a culture of risk analysis. So what is the role of Joint Commission and national bodies like NABH and NQAS. In India, proactive risk assessment is initiated in some hospitals, though the support of the National Accreditation Board for Hospital NABH and the other healthcare provider movement is one which is appreciable. It has been seen that with the efforts of all this accreditation body, the visibility of risk analysis has increased in hospital sector, and hospitals are found to be very responsible to take this and initiate that the incidents should be reduced. What is the benefit that we have to study? Again, the Institute of Management report of 1999. I have been emphasizing of this because the reason is that you have to work towards a culture of no harm. The very first report of Institute of Management, that is 1999, to Error is Human, Building a Safer Health System, explain you in detail about the reasons actually that we have to make our to the organization really responsible that reducing errors or working on no harm. The estimated death due to medical errors in hospital exceed the attributable death to road traffic accident, breast cancer and AIDS. We may come across with major issues of road traffic accidents and breast cancer and AIDS to be found as the cause of death. But compared to see, if you find the hospital deaths are much more actually in relation to this. So one of this report main conclusion is that majority of the medical errors do not result from individual recklessness or actions of a particular group. They are one which is out of a system problem. So this is not a bad apple problem. Errors are commonly caused by faulty system, where we can say the normal accident theory or Swiss cheese model is one which will make you explain actually that how this bad apple problem is not one only with one an individual or a particular group of people. It is more because of the faulty system. It is more a system problem, and where the system approach is very important to deal this problem. The processes and the condition that lead to make people more to happen mistakes, or they sometimes fail to prevent them. It is not that the healthcare workers or the employee are one who are very prone to that. They are led into a system actually which makes them more possible to cause this. So there is no such as a bad apple actually to be identified and removed. It is not an individual person to be blamed, or it is not individual group of people to be blamed. It is more the system fault to be identified. That was one which was mostly reported in the Institute of Management report. And we may need to even recall of those report and to study like how you need to build a system, a safer system we can say, like a system strengthening activity we need to do it for. Now we will have a discussion on the systems approach towards the patient safety which I was trying to talk about, where I want to give emphasis on one of the very popular author actually who have entirely given his writings actually which have come into different books actually and very popularly from checklist manifesto to the very popular book called as Better. Dr. Atul Gawande, an US based doctor, points out in his book Better the work of a healthcare professional. A work of the healthcare professional, he says, that is not just a matter of clinical diagnosis. He says that technical prowess and some ability to even empathize the patient as well. It is more important that empathy plays a very important role along with the regular activity that the doctor has to do. What is the reason of this? This is more directing towards the system approach. It is more making us more responsible towards the patient safety. The reason is that to be more better into the hospital, it is more better to how you die actually over there and how you need to work on developing a culture which is more towards understanding the patient's need. So medicine is an inherently risky system. It has been seen into the entire reading of Dr. Atul Gawande's books actually that you may find that how he is trying to come across with resilience and even the better way of dealing with the problems. Resources, circumstances, people, and one's own shortcomings as well as to be studied. Very importantly, that all this need for a systematic approach actually that to reduce the risk and increase the safety of the patient. Because when you try to work on risk or risk management, you are more moving towards safety of the patients. Now, we will try to understand what are the various types of risk faced by a patient or patient's relative by the hospitals. The first and very important is the clinical risk. The risk to patient safety as a result of a failure in the process of clinical care. Patient is coming to the hospital, healthcare institution for clinical care. And if at all you find that there is a result of the failure of in the process, it is very inevitable that the patient may go up with a clinical risk. The overall risk is directly proportional to the magnitude of damage and the likelihood of the occurrence. There is very chances actually that if the magnitude is a large or sometimes huge, actually it is there that the damage can be of the same level or much more, or the chances are more that the risk may happen again and again. You can take examples of fall of a patient from the bed, or sometimes sleep of a patient because of not providing anti-slippery floors. You may see the patient may even slip into the bathroom, or if the patient may even slip during the walk actually in the room. So there are many and multiple ways actually to identify, actually to understand that how you need to curb this risk. As the treatment are becoming more complicated and technical, there is more scope of errors in both diagnosis as well as management. It is very important to understand that these complications are leading to lot of first time we may come across that diagnosis is one which is very getting difficult actually. Likewise, after the diagnosis or sometimes actually wrong or whatever is the misdiagnosis, even treatment on the plan actually also goes very wrong. And you may come across that the list develops and it continues actually. In year 2006, followed by the Institute of Medicine study, which shows that at least 1.5 million people are affected in US because of these errors. This can be a situation being seen in different other studies in world across. Now we'll understand the second type of risk. What is the second type of risk actually which we can commonly occur or can see in a hospital? That is a financial risk, which is very important. In country like India, financial risk is one which is a major problem to the patients. So hospital financial risk overview. Here we will try to understand what are the major things that can affect financially to a patient and even to the hospital. Where we come across are external forces which are there, and you may come across with larger hospital financial risk. There are ways actually to be seen over here in the first and second, third, fourth and fifth way to understand how this risk identification is also done. Even a systematic review also is required if at all there is a need in addition to this. The first is like market dependence and revenue, which is like attraction retention of the crucial for a revenue which is being seen in the first place. Then large customer base risk, guaranteed demand, but terms may be one sided, which is sometimes very much a need, but it is being on terms one. Credits and claim, huge long term credits, irrational disallowance of claim, capital investment which is done, or mismanagement and lack of cushion, unhealthy practices, no financial cushion. So from an hospital part which may affect the patient, actually we may come across largely not first as a patient having a financial risk, the hospital through its one put the hospital financial risk. There are even external forces actually which may see that it is from the corporate and the market terms dictated, that is insurance, government scheme and corporate clients. These are one which are more influencing actually to initiate, or you can say it takes ahead to the hospital financial risk. What are the ways of identifying this? If you have to identify, you have to come across actually for this, you may come across the risk identification through different ways. First is with the balance sheet that you may come across with this. Second is the capital structure that it is. And then it is more with the bond intenders. And lastly, loan agreements. You can come across with the risk identification by even systematic review of the required documents, and you may come across that the hospital may come up into financial risk, which is also a very important risk to be studied into risk management. Then comes the risk as health and safety, how it is being taken as. Any environmental factor having an impact on the health and safety of a patient, visitor or employee. The Food and Drug Administration, that is FDA, and the Joint Commission on Accreditation of Healthcare Organization, that is CAHO, have studied the potential for injury to patient due to failure in oxygen supply system. Many times it is being seen that these external agencies are pointing of very important issues which are dealing with the healthcare. So in their case studies, their reviews, their literature, the total expected number of facilities from oxygen system failure is 44 over a 30 time horizon, 30 year of time horizon. So it has been reflected that this is an observation which has made a concern to be raised for. The greatest contribution to the risk, that is 94% of the expected number of fatalities actually, comes from the problem that involve the supply network. Example is like damage to structure and poisoning as the opposed to the incident that occur inside a patient room. So you may come across lot of issue with respect to health are being discussed by these two agencies, and which becomes again a point of concern to us. There are different risks ahead in discussion now. We will be taking legal risk. What is a legal risk? An issue leading to medico-legal suit or consumer litigation. A litigation which might be filed by a consumer with respect to COPRA or Consumer Protection Act, or a medical negligence suit which may coming with lot of issues which the patient has faced with respect to the negligence part, where we may talk about medical negligence. So according to a survey, a doctor in US faces 3 legal suits in their lifetime. So this has been seen as a great trouble or a headache actually to a physician who comes across to such issues. If you are getting more awareness about this issue, you may come across lot of legalities. In India, most doctors are worried about the risk of medical legal cases more than anything. They are being more studied with lot of issues which are coming with lot of patients' expectation, and sometimes even with the process it is making more difficult actually for them to deal with these challenges. Then the next risk is quality and performance. Any event leading to compromise on the quality of care will give you more a problem on your performance. Example is like sudden resignation or leaving of a doctor leading to an increasing waiting time, which is a common problem to be seen in our country. Most of the time, this has been led to a problem of staffing. The second example is like shutdown of the computer system leads to a delay in service of the patient, which is also very common problem to be seen in government as in even other sets of hospital, because this leads to an impact of the dependency of technology versus actually to the manual practices, and sometimes a difficulty in disrupting the entire process of treatment. The next risk is reputation. Event leading to the spoiling of the reputation of the organization. Many hospitals face this issue or have been seen into their past experiences that it has one of an issue have spoiled the entire name of the organization or image of the hospital, or even patients who are selecting their choice are made on the incidences that the hospital has really gone to. It is like a bad name to an hospital. Example can be like high nosocomial infection rates. You may come across with some of the government hospitals which are very much defamed actually for particular wards which has a high infection rate, or sometimes patients are more dying into particular ward, or even hospitals actually the image is there that most of the patient go into those hospitals and they die over there. So it is more not because of something which is undue over there, but it is more because of high nosocomial infection or hospital or healthcare associated infection. An example like media involvement in patient hospital conflict. Sometimes most of the hospitals don't have a proper PRO sort of facility, or they don't come up across with a proper healthcare communication either with the patient or patient relatives, and they face lot of issues. So there are a reputation issues which may be highlighted by the media as well as even the public or patients actually, which may give the hospital more a reputation problem, which can be seen like a more media involvement in patient hospital conflict. Then is a risk like service delivery, which is a very common problem to be seen in most of the hospital, especially in Indian culture. We may come across with lot of issues with respect to supply and resources. So any event leading to closure of a service or the whole of the hospital, sometimes you may find that one of the department, one of the services, or even sometimes an entire hospital is closed because of particular service get halted. The example may like water supply problem, power, equipments, even sometimes with human resource. The reason is like the entire service delivery is affected, and so where we may come across that this is a major risk to be seen to Indian hospitals. Though it may come as to be seen as a small problem, but it leads to a major impact on the services actually, and this should be taken as a major risk. Then there is the risk called as customer related risk, where you may see it is a consumer, customer, or a patient, where healthcare organizations often face many unpleasant events while caring from their patients in terms of violence, where the staff are abused or property is destroyed. We can say vandalization, and nowadays it is very much increasing. You may see a lot of incidents happening into government hospitals, public hospitals, and they are faced actually by the healthcare workers, doctors, nurses, and all that. The reason is like the customer or the healthcare provider relationship, doctor patient relationship, nurse patient relationship. So this is the problem of more of healthcare communication. Even more, nurses are subject to the verbal and physical abuse so frequently that many instances they have to tackle the issue with the help of the administrator security system, and sometimes they face lot of violence actually. It has been sometimes been seen as accepted part of their job, and the morale actually or the motivation they get it is very low. So we need to understand the risk which is even faced to the healthcare employees, and this has been more by the patient or patient's relatives. Then we come across the risk of data loss. A lot of data which the hospital has through the MRD or with HMIS and all those, like with misappropriation of hospital records in various form is considered as a major risk. Loss of electronic database and information which is very valuable is very crucial. In an incident, the health records of 20,000 patients in Stanford Hospital made that the way onto a public website, and the data was accidentally used as a part of a job skill set. This was also in incidences which have been seen in COVID time in Indian hospitals also. The private medical data was exposed for nearly a year before official order is taken down, and there are several other incidents like this which has been recorded. So healthcare information can go out offhand unless appropriate technology is placed to prevent it, like data security and data handling in a very sensitive way. Employee risk relation, like there are multiple studies actually, even the study which is being highlighted over is like effect of employees strike in patient care. The researchers noted from 1984 to 2004 in New York State, the average number of hospital nurses goes on strike. The issues are more because when the employee related issues are not taken ahead, and you may come across a lot of affected patients are more because of this issue. Even in India, we come across with a lot of issues which are more related, that the hospital strikes have given a great impact on the patient's admission as even a healthcare delivery system. Risk related to non-compliance with statutory requirement. The hospital is not able to meet the requirement, and when partially or not completely met, it leads to major risk. The statutory requirements can be a guideline and the rule of local authorities which has to be established, and the hospital has to abide it. If at all they are not able to meet it, actually it may lead to lot of issues, issue of safety, environment, radiation, utility services, and labor laws also. And in summary, we can say over here in this particular chapter that hospital face multiple type of risk. The risks are being listed like clinical, financial, legal, safety, reputation. We have seen with data and even regulatory risk. The risk may be seen into as a clinical risk or a system-based failure or even non-clinical risk, which has been seen that a lot of all these issues have to be tackled with an analysis plan. The hospital need to understand with the help of the team that if you have to go with a risk management program, it should be structured, it should be continuous, and it should take a support of accreditation bodies like JCI, NABH, and QAS. Quality improvement initiatives are also to be supported, and why it is very essential to take ahead of this, enhancing the possibility to reduce patient safety incidences and organizational reliability. The ultimate aim is overall healthcare quality. So with this, we come an end to this chapter and the discussion over here. We will be continuing further for this in the concluding next chapters. This can be seen as the references supporting to this. Thank you very much.